Alpha-1 antagonists. So alpha-1 adrenergic receptors are located in many areas of the body, but the one that we're going to be talking about more is the alpha-1 receptors found in the vessels. How does alpha-1 antagonist work? So it works by blocking alpha-1 adrenergic receptors. So alpha-1 sympathetic receptors are located in, again, many areas of the body, but mainly here on the arteries. If they are stimulated by epinephrine or norepinephrine, it can cause vasoconstriction, therefore increasing the blood pressure. So alpha-1 antagonist actually prevents norepi from attaching to the arterial smooth muscle, which causes arterial smooth muscle relaxation. So this is an illustration of the mechanism of action of alpha-1 antagonist. Again, this is your vessel. So what it does is that it blocks the receptors found on the vessels. Therefore, it prevents the norepinephrine or epinephrine to bind to that site, therefore causing the blood pressure to go lower. So alpha blockers interrupt the stimulation of the SNS at the alpha-1 adrenergic receptors. So more specifically, alpha blockers work either by direct competition binding to the receptor and preventing norepinephrine from binding to the receptor. So this is that example right here, right? By competing for that binding site, but it can also do it by a non-competitive way, by basically making the receptor less sensitive to norepinephrine. This image can be found on page 304 of your textbook. This is figure 19.1. So this is basically showing the competitive blocking ability and the non-competitive blocking ability of the alpha-1 antagonist. So on the left is basically competition, right? So it binds to the area, to the receptor, therefore blocking norepinephrine from binding to the site. On the other hand, it basically makes the receptors less sensitive, so even if there's norepinephrine, it doesn't really bind to it. Therapeutic effects include low blood pressure, so it decreases constriction, therefore relaxing or dilating the peripheral arterioles and the veins, which results in a decreased PVR and decreased afterload. It also relaxes the smooth muscle of prostatic capsule in the bladder neck for patients with benign prostatic hypertrophy or BPH. Some indications: hypertension. So alpha-1 antagonists are used for hypertension. In addition, these are also used for benign prostatic hypertrophy or BPH. There are also alpha adrenergic receptors in the prostate and bladder. So by blocking the stimulation of the alpha-1 receptors, these drugs reduce the smooth muscle contraction of the bladder neck and the prostatic portion of the urethra, which relieves the symptoms of patients suffering from benign prostatic hypertrophy. Some precautions include concurrent use of multiple drugs affecting the blood pressure, because it does increase the hypotensive effects, especially if they're on multiple blood pressure medications. In addition, we have to be very careful if a patient has hepatic or renal disease. Contraindication: acute heart failure, because it is associated with an increased risk of new onset of heart failure. Side effects or adverse effects include orthostatic hypotension, especially if the patient is also again on other antihypertensive medications. In addition, it can cause some dizziness and headache. Some nursing actions is assessment of the heart rate and blood pressure, as well as INOs and urinary symptoms. You want to treat one for the effect, right? Are you getting the effect that you want, especially if you're giving it, let's say, for the BPH patient? That's why it's important to assess for urinary symptoms. In addition, patient education is very important. So again, we want to teach our patients regarding the drug. What are the side effects? How do they monitor their blood pressure at home? And what are the effects of the other drugs that they're taking with that medication, as well as emphasizing the hypotension symptoms, as well as urinary function. Examples of drugs in this class include doxazosine or Cardura, or prazosin or Minipres.